California teen Chole tells DeSantis hearing why, quote, wait until they're adults, end quote.
First started to experience gender dysphoria. And
Chole, thank you so much for being on tonight. Now, we heard a bit of your story just moments ago. Tell me how this all started.
So I was 12 years old when I first started to experience gender dysphoria, and I came out to my parents as transgender, and I expressed that I wanted to seek a medical transition, and shortly after they referred me to therapist, general pediatric therapist.
And at that point, did your parents, ask for multiple opinions from multiple physicians over, a lengthy period of time, or was this kind of a quick series of decisions that were made?
So pretty much all of the medical professionals kept pushing the idea that transition is the only path forward to treating dysphoria.
What do you say today to young people who might be feeling gender dysphoric, or they think they are, and they're moving into this, whether puberty blockers or actual surgery conversation with physicians? What is your advice to them?
Ask yourself, what is it that makes me feel this way? And what is it that makes me want these treatments? And
do you think they're being forced into thinking this way, or is it the power of suggestion? Are you concerned in certain cases, whether school counselors or the media or Hollywood or just general influences? Is that part of your concern here?
I would say it's case by case thing. There are some children who are pushed into transitioning by, say, their parents, teachers, physicians, but sometimes it's really just a matter of parents being effectively guilted into transitioning their children.
During the recent hearings in Florida regarding the push by DeSantis administration to prevent Medicaid from covering gender-affirming healthcare costs, California teen Chole spoke out in support of the plan. Chole is one of the fewer than 2% of individuals who have undergone gender-affirming surgeries and then detransitions. Assigned female at birth, Chole had begun transitioning to male, receiving hormone treatments and having top surgery to remove her breasts. She says that after learning about the possible bonding between a mother and a baby during breastfeeding, she decided to detransition and return to living as a female. She said that prior to transitioning, she was told by therapists that she did not understand the ramifications for her choice, but decided to continue the process. Her hormone treatments started at 13, and she had her mastectomies at 15. She now travels the country speaking out against transgender care initiatives. At Friday's hearing, she warned Florida lawmakers, quote, no child should have to experience what I have, end quote. When asked what her advice to the public would be, she responded, quote, do not transition your kids, end quote.
You smell that? You smell that? This smells funny to me. Doesn't it smell funny to you boys? I mean, like, I don't know. She's coming across as a paid actor to me, and she can at least do the damn interview somewhere aside from a car.
Well, I feel sorry for her. I mean, she's obviously a confused young teenager, but I kind of don't get her being the speaking person or the speaking piece for the Republican Party on this issue. I mean, I don't know if she privately paid for her gender transition, if it was publicly funded, but what we're talking about in Florida, she's from California, what we're talking about in Florida is whether you should be able to use public funds for that purpose. She obviously had a bad experience, but what she's saying in Florida is only people with enough money to pay for it on their own should get it, but if you're poor, you shouldn't have the same access to those types of gender-reaffirming medications and treatments.
Right.
Well, in Texas, they're already saying, investigating parents who help their children start hormone therapy and stuff like that. So it's not just about using the money, it's about being able to do it all. And I did the math. We've talked on here before that about 2% of the population is trans. If based on 330,000 or 330 million Americans, if 2% of that 2% decides to detransition, we're talking about 132,000 people. And of that, we would only be talking about the ones under 18. So this affects a very small amount of people, but Chloe, you don't get to set policy for your peers. You just don't. But by the way, God bless her parents, because clearly they had to be on board and supportive of her when she decided to do this at 13 and start the journey, whether she continues it or not. Good on her parents.
And I think that, you know, even though it's only 2%, the headline might as well just say 99%, because that's how Republicans are going to read the story and they're going to interpret it. Because,
and that's how they're going to present it.
Right, because now they're spinning the narrative after watching that interview that she was forced to do this. And she was forced to do this by her parents. She was forced to do this by her school counselors. So this is the narrative they're trying to spin to be like, see, look, this is what the public schools are doing to your kids in school. This is why we can't say gay. This is why, you know, X, Y, and Z.
For sure, and that was so clear. I really appreciate that, Kyle, because that's exactly, I mean, there's so many layers to the story, but to me, one of the kind of big takeaways from this was that horrible interview with Ingram, right, where she was so clearly fishing like, you know, this was the counselors, they made you do it.
Right, they made you do it. You saw people on TV, right? That's why you wanted to do it.
To instrumentalize this poor young girl's experience and to exploit her experience as if this is going to be universalizing experience. I mean, the stats show that that is so clearly so far from the case. And she knows that.
And she knows that. And she said it herself. Therapists told me. They warned me against this.
I don't know if she really knows this, though. She's 17. She started at 13.
I meant Ingram.
Ingram knows. I think 13 is too young. That's my personal opinion. But I guess every case is different.
And that's between a parent and a child, Michael. That's not for anybody else to decide, you know?
And I think as a society, we need to start getting on the same page when it comes to there's a lot of talk about rights at certain age. You know, we fight for the age, you know, to purchase a weapon for a higher age. Why is it okay for a kid to transition? Personally, I think kids are too young to make that decision on their own until they're adults. I have these conversations with my trans friends, and I've had a couple of friends who have transitioned. They've held fundraisers, they've raised thousands of dollars, and then they decide to detransition back just because out of a whim. Well, that's not fair. Then I want my money back. You know, like, because you don't get to be, you know, a social, and I don't want to say like a charity case, but that's exactly what it is. And I think they're using the platform wrong. And I think that, you know, even for bariatric surgery, you have to go through therapy in order to make the right decision for yourself. So there should be some ramifications and, you know, a waiting period, you know, in order to do something like this.
But Cal, this is not something that also happens overnight. This takes years, even, you know, with therapists and certain things that you need to do and certain people that you have to talk to and, you know, school counselors. It takes a tribe for this to happen for a child.
Yeah, but you gotta be 21 to go to the bar and have a drink, and she's starting gender-affirming procedures at 13.
And now she's being used. Okay. At the end of the day, like when I first read this story, I have to admit I was mad and I kind of wanted to go and be 16 years old and go beat her up, right? And then that quickly changed, boys, because now I feel bad for her. Right. You know, I feel sorry for her. When they're done using her, she's going to be left alone to this, 100%. You know? And then what? Then she's going to need more therapy because, I mean, the PTSD, everything is just going to be so much. She's never going to be the same.
Well, like after watching this interview and seeing how she responded to those questions, she's going to get coached now. Because that's what happens in these situations. She's going to be coached into how to answer these questions in the future, and you're going to see the difference in a couple weeks or days. Does it whenever it happens? And watch, she'll be speaking at the Republican National Convention.
Yeah. And can you imagine other LGBTQ plus kids being friends with her? Like, who are her friends going to be?
No one. A starving stray cat in the dumpster behind a restaurant wouldn't be her friend.
LGBTQ plus news is vital for our community and for the broader world as a whole. We have enough enemies at Fox News. Tucker, Sean, and Lara are loud. We need passionate allies. Happening Out television network, Queer News Tonight, and It's Happening Out are literally out of the closet and into the headlines. Our community needs your support. Like this broadcast and subscribe now to ensure the growth of the entire LGBTQ plus community.